All right, so good morning, esteemed colleagues, ladies and gentlemen, directors on the call, deputy directors, staff of the Department of Health Planning, Research and Statistics. It is my distinct pleasure to welcome you all to the second monthly departmental webinar. It's second in series, hosted by the Department of Health Planning, Research and Statistics, Federal Ministry of Health and Social Welfare. Today's session is part of our ongoing commitment to strengthen internal capacity, foster interdivisional collaboration, and advance the departmental strategic vision through shared knowledge and meaningful dialogue. Our theme today is both timing and, of course, very critical. It is translating research findings into decision-making in health policies and planning. As we all know, evidence-informed decision-making is at the heart of effective health sector governance. Bridging the gap between research and policy is not only essential, it is strategic imperative. We had been waiting, expecting the director to join to give us his opening remarks, but he has permitted that we should go on and is able to join us as soon as possible to do the needful. Well, before we start, I think we would want to quickly take the national prayer, and then we'll have our keynote speaker to take the stage. So if you are able to say from your end, we'll just recite the national anthem, the second stanza. With a count of 2, 1, 2. O God of all creation, grant this our one request. Help us to build a nation where no man is oppressed, and so with peace and plenty, Nigeria may be blessed. Thank you once again. Without further ado, we will quickly introduce our keynote speaker, who is already on the standby to do the needful. So we have Dr. Olugbenga Ijaodola, who is the head of research and knowledge management, and also the national coordinator, Nigeria Digital Health Initiative. So, sir, this webinar is supposed to be for 1 hour. If you're able to help us present in the next 20 minutes or 15 minutes, we are happy with you. So you have the stage, and over to you, sir.
All right, thank you very much, Dr. Heko, and good morning, everyone, colleagues. Please, Heko, can you confirm that you can hear me?
Yes, you're audible enough. If you're able to put your slide on slideshow, so that it will be more visible from our end. Thank you, sir.
All right. So just a minute. Well. Just a minute, I want to. What's going on? I'm trying to, yeah. It's just a minute, yes.
You don't mind I share from my end?
Okay, please go ahead.
So you would need to unshare.
It's already on, but I'm just trying to put it on the slideshow mode, but it's not really coming on. Just a minute. I think yes, I've gotten it. Sure. Yeah, it's better now, right?
Yes, please. You
Okay.
can.
All
Thank
right.
you.
Okay. So, colleagues, apology for that short each, but I think we can just go ahead. Yes, I'll be able to do that in the next 15 to 20 minutes. And you kindly please just continue to remind me if I'm getting out of that particular time.
Yes, please, sir. 1 minute, just to let colleague know that they should feel free to use the chat box for comments and use the Q&A session for questions. And we're happy to extract that for you to respond appropriately. Thank you, and over, please.
All right, good. For us to achieve the universal health coverage and being able to also contribute significantly to the sustainable development goals at all levels, it's important that we embrace significant domestic research capacity. Why do we need to do this? It's important for us to know so that we'll be able to produce quality scientific evidence that is based on critical key areas of social development and policy challenges. This evidence will help us to inform, contextualize relevant actions and reform for economic growth, development, and welfare. So this presentation is to help us to sensitize us on that continuum and the cascade. Doing research is not the end of any form of effort. Ensuring that we translate what we find out from our research effort into helping to make decisions across every action we are taking in terms of improving health in Nigeria is key. So today we are not looking at how to conduct research. We are not looking at the various steps in conducting research, but today I want to sensitize us in this conversation on key things that we need to know in terms of translating our research efforts and findings into quality facts for decision-making in Nigeria. So we'll be looking at a short introduction. We also want to ask why research, what is research to policy translation? Why does it really matter in Nigeria? What are those factors that are influencing? What are those factors that act as barriers? What do we need to look at in key strategic areas? What are those further breakdown of those strategies? How do we ensure that we implement effective communication mechanisms? What are the current institutional and governance supports? Then we touch on one or two global and Nigerian case study. And then we also make some recommendation. What are the way forward? And then we conclude. So like I said, this is going to be more like a conversation. And I believe that what I'm trying to do is just to create that environment, and then everyone will be contributing. It's not a new finding that we are currently facing some form of transition in terms of evolving disease body. We're also facing what we call issues with limited resources available. And then over the years, we have identified serious gaps in our health system for healthcare in Nigeria. But with this, we've also been able to conduct different researches across board. We've been able to ask those questions. We've been able to take many steps. But what we've been able to find is, how do we ensure that those research findings, those questions we are trying to answer, those key capacity to collect data, how do we ensure that we translate them into facts that will help to improve on actionable policies and strategic planning? So it's very clear to say that bridging the research policy gap is key and essential if we want to achieve the universal health coverage. We want to ensure we do that by optimizing the current resources that are available, and we want to see how we strengthen our healthcare system to be able to meet up with the key challenges that we have. But we also identify that there are key barriers that we also need to look at, like weak institutional linkages, limited capacity for us to be able to make use of the evidence, and the lack of structural mechanisms for us to manage the available knowledge and translate it to action. So, as a form of introduction, it's important to know that evidence-based informed decision-making is key in trying to optimize its outcomes, and because this supports policy formulations, and this is based on a grounded, solid research and data generation findings. Nigeria healthcare system is characterized by lots of numerous challenges in terms of producing the right and quality services, which include, like we all know, resource limitations and the fact that we have a complex, diverse ethnics. But for us to understand this is fundamental, to know the root cause, to identify the key steps that we need to take, and to translate that into action is effective for policy decision and planning. So, what exactly do we mean when we said we talk about research to policy translation? We are talking about the capacity to conduct research, to ask questions, and to provide answers, and to ensure that those answers meet the gaps, the demand in terms of knowledge exchange and evidence-informed decision-making. It's a process that is dynamic, it's expected to be interactive, and often iterative, requiring engagement of all key stakeholders, both the researchers, the policymakers, and also the decision makers. Why do we need to do this? Like I said earlier, it's important for us to achieve the universal health coverage by 2030. And that's like just 4 years to go. And to also contribute to the sustainable development goals. So making research-informed policy central to this effort is key if we really want to meet up with that particular timeline. So the research policy disconnect is identifying those gaps between and ensure that we translate it into policy planning for us to be able to meet up with those gaps and overcome those barriers. So quickly, let's look at those factors that we need to take note of. Policy versus research. We need to understand the various key priorities between the policymakers and the researchers, because we need to find a common ground for effective collaboration. We also need to see how we improve on the misalignment between the researchers' priorities and the policymakers' urgent needs. This has always been an issue, really, because sometimes they don't really align. Why? Because there are other key factors that the policymakers are looking at, and they want answers. And probably maybe the researchers are not looking at it from that particular point of view. So misalignment is one key challenges that we are facing. Institutional cultures is also one challenge that's an influencing factor. The culture within the institution can significantly impact the translation of research into policy. The issue about bureaucracy, funding constraints, and the fact that we are not able to establish a system of institutional memory most of the time always have a very negative impact on translating and making use of the research findings. Governorship and leadership, the need for strong governance and leadership is also essential for us to create a conducive environment for conducting research and ensuring that we translate it into use. Limited structure platform collaboration. We need to create more platforms. We need to ensure that we create that synergy between the generation of research and research findings and translating into policy decision. The political context is also one key factor that we need to consider. The political will, the political priorities, the direction, the socioeconomic conditions of the feasibility of how we translate what we find or the data we are collecting into policy implementation. Then we also look at the periodicity. At the time that this is being done, how much of it is useful? Because most of the time we conduct this research, we identify this data, but because of the urgency of what is expected to be done, most of the time it's not being useful. So what are the barriers? Quickly. The timeline discrepancy can hinder the integration of timely research findings into policy. I just explained that. Most of the time, we find out that we go into that effort. By the time the result of the research is available for use, a lot of things have changed in terms of decision and priorities. The engagement platform, ensuring that we create platform real time for discussion and knowledge sharing is often limited. It's something that sometimes what we are producing, we are bringing out from research, sometimes find it so difficult for us to make use of it in terms of policy. So this has to do with able to have some form of contextual understanding of what is needed for us to ask and to be able to provide answers so that those particular outputs will be useful at the end of the day. Resources and turnover. There is resource constraint. The priorities across both at the global and national level is changing. People want answers, people want actions, but people are not really interested in committing resources into creating those questions for us to be able to get the answers. And again, we look at the fact that the staff turnover has negatively impacted the sustainability of research translation effort because of the fact that most of the time, people that are really involved are able to not being sustained across board. So we have this research, we have people that have this understanding, we have these people that are be able to ask the question and to be able to conduct and provide answers. But at the end of the day, they are not available to be able to give understanding and more context into those outputs in terms of translating into policy decision. So there are some key approaches that we also look at. We talk about the push strategy. That is, we need to see how we disseminate digestive policy briefs using data for us to be able to pick the picture. We want to see how research disseminations led by researchers to promote uptake because they have the understanding of what is it that they are preparing and they are producing. And they'll be able to improve and increase and be able to add more context into that. Under the push strategies, it's important that the Ministry of Health commission priority-driven research looking at the various data, looking at the key areas that we've identified for policy direction to be able to improve on it. It's important that while we are discussing that, it's important that we support research that are focusing on those particular areas for us to have more understanding. And it's also important that a policymaker-driven demand that encourage research relevance. There should be continuous engagement with researchers for them to understand the particular direction that the policymaker need for them to look at in terms of creating questions and also ensuring that we produce the answers. Then also it's important that we also encourage exchange, creating joint task forces between the researchers and the policymaker, continuous engagement, not just because of the need to improve on policy, but just to ensure that we create that platform for continuous engagement at every particular time, and ensure that we have collaborative partnership that facilitates knowledge sharing and mutual. It's a two-way affair. It's important that we make our policies, we engage with all the researchers for them to have understanding of the direction the government is going to. And it's also important for the researchers to be able to engage the policymakers to be able to have a clear understanding of how it is that whatever is coming out from our research findings is useful for policy direction and policy change. So what are the key strategic areas? One key area that we need to understand is the need for us to ensure that we do a kind of contextualize and right on point research design. So it's important to design the research that will be able to meet up with the priorities of the government. So it's expected to be participatory and to have a kind co-creation approaches for us to be able to ensure that it's aligning with the policy needs. The next one is for relationship and trust. We need to build mutual understanding. This is not a competition. It's a way of aligning together to ensure that we reach that common goal. So it's important for us to build that mutual understanding and to ensure that we have this openness and engage in open dialogue for us to be able to meet up with our demand. Dedicated role. We need to understand the various responsibilities of everybody involved so that there's no clash of action, there's no clash of work, there's no clash of knowledge. It's important to ensure that we identify, we conduct that mapping to know who is doing what at any particular time. Capacity building, like I said, is also a two-way affair. This is one key area because if you want to ensure continuity, we must identify how we ensure that we continue to build capacity, both the policymakers and also the researchers, for more understanding and be able to translate research as much as possible into policy funding. So let's quickly look at these strategies. Under the research design, it's important that from the beginning, there is stakeholders engagement and involvement. We also want to look at ensuring that it's aligning with the policy direction. And we also want to see how we plan, how we are going to translate this into strategic documents. For the relationship and trust, it's important that we build understanding. There must be culture of transparency so that everybody knows that there's no hidden agenda, everything is open, and for us to achieve a common goal. We must also ensure that we create a very good mechanism for engagement. We ensure open dialogue, and there's needed for feedback mechanism for productive relationship. Trust and collaboration is key. So there should be some form of strategic planning fostering trust to engage all the key stakeholders effectively. Under dedicated roles, it's important for us that we identify the intermediaries that will help us to facilitate flow of information between the policies and the researchers. There's a need to create right on points and needed committees that will be able to guide research relevance and be able to identify the priorities. Then we need to see how we embedded researchers in terms of our real policy development. across board. Number 4, capacity building. It's important for us to equip all the policymakers with skills to critically appraise evidence, ensuring informing decision. We need to see how we improve on communication and other skills in terms of translating the findings. And then we need to embrace the use of digital tools that will help us to enhance accessibility and usability. So there are three effective communication mechanisms that I would like us to consider. The first one is to see how we have these diverse communication methods that will ensure broader reach and engagement. We need to also see how we have the tailored communication to specific key areas, to specific audiences, to ensure understanding and impact, and to see how we improve on stakeholders' engagement across various levels. Currently, in country, there are key establishments that we need to see how we improve. The National Health Research Agenda is to ensure that we collate and have a kind of a cohesive agenda that ensure that our research efforts align with national health priorities. So in the development of the National Health Research Agenda, we need to understand that the policy priorities, the key direction that the government is going, are key areas that need to form the majority of the research effort that we are putting together. The National Health Research Committee, that's one of the bodies that play a very critical role in upholding research integrity and relevance. And it's important that we continue to engage them, especially when we are discussing the issue of the policy direction in Nigeria, for them to be able to facilitate and support research priorities that will meet the need of the country. Institutionalizing evidence use, we need to develop institutional framework that are necessary for embedding evidence use in policy processes. So just some form of a case study in at the global level in Nigeria. In Rwanda, some years back, they were able to improve on HPV vaccine adoption in country because they were able to align all their researchers with the policymakers to identify what are the critical this particular effort. And with that, within a particular year, they're able to move from like less than 20% coverage to over 90-something% coverage, because they were able to make use of research and were able to translate the research findings into policy action. And we can also see the way we have been able to do in Nigeria with policy eradication effort through research policy alignment. There are other key areas in terms of developing our National Health Act. Some of the key areas we make use of the funding from the understanding from the use and implementation of the Basic Healthcare Provision Fund for us to be able to have some key understanding of the direction that we need to put for health financing in Nigeria. The Nigeria HIV Indicating and Impact Survey of 2018 was able to lead to a major shift in HIV programming and resource targeting in Nigeria. The same thing goes with the way we respond to COVID-19, and also when we are looking at issues around the human resource shortage. Can you hear me? Hello, can anyone hear me, Dr. Echo?
Yes, we can hear you now. We lost.
Can I be guided? When was that? So that probably maybe I can go over that quickly.
Just like 5 seconds back.
Okay, 5 seconds. Okay. Okay, so I hope we're able to have a clear view and understand exactly when I was making some key justification on the case studies. Dr. Echo? Hello? Hello, can anyone hear me?
Yes, so we can hear you loud, clear enough. though
Okay.
with some breaks, interruptions with your network intermittently.
Apologies. So can I continue?
Yes, if you're able to wrap up in the next 2-3 minutes, we'll be happy so that we
Okay.
can wrap up this session, please.
So again, just to use this to also emphasize that one way or the other, we have been able to make use of translating our research findings and data generating efforts into decision makers in some of the instances. All right, so what are the recommendations? It's important that there is some policy coordination. So we need to create dedicated units to facilitate sustained collaborations and ensure that we continue to fund the current effort towards knowledge translation in the Ministry of Health. It's important for us to invest in knowledge management and translation as one of the key areas to ensure that we sustain this effort. We need to build capacity of policymakers in evidence appraisal, train researchers in policy communication, and also ensure that we embrace the use of research in terms of refining our strategies, and also leverage on the digital platforms for data generation to improve on data availability for research interpretation. What are the way forward? There should be collaborative, more collaboration. We need to create mechanisms across board. We need to ensure that we continue effective health initiatives, partnership that can lead to effective improvement. We need to also look at embracing the evidence use culture. Use of evidence-based for decision-making is critical for us to be able to achieve the universal health coverage. The need for more commitment. There needs to allocate budgets for conducting research and also translating the findings into action. We need to ensure that we build the capacity across board for everyone that is involved. We could start a program of embedding academics, researchers to be part for a period of time in the ministries for them to have understanding of the processes involved and the thinking behind policy direction. And the same thing goes also the other side. We also are the research institutions. We need to see how policymakers, policy developers also have an understanding of the way it is to start thinking of what are the key research effort that need to put in place to improve on policy direction. And again, we need to ensure that every key stakeholders involved is committed to improve on availability of research findings to improve health outcomes in Nigeria. That is the end of my presentation. Thank you very much for listening, and over to you, Dr. Eko. Dr. Eko, I hope you didn't lose me again.
Yes, we heard you very well. Thank you very much for this presentation. Before we continue, I'm not sure there's any question on the Q&A session. So yes, so we have the Director, Department of Health Plan Research and Statistics, Dr. Kamewu, who has been listening keenly to the presentation. So we'll quickly have him give his remarks.
Good morning, ladies and gentlemen. Thank you, Dr. Ijaodola, for a wonderful presentation. And just to also join you in reminding everyone that we don't do research for the purpose of research alone. We do research in order to expand our knowledge, to have a proper understanding of certain phenomena, and also to see how research can help us in decision making, making clarification to what we probably do not understand. And this is part of what has been shared with us this morning. And as a department of health planning, research, and statistics, it is our duty to ensure that, one, we are aware of the various researches that are impacting on the health system, also bring this to the knowledge of our staff and our principals, and more importantly, indicating the implications of such research products or research outcome and recommendations on how it will impact on what we do in serving the Nigerian people in the health sector. So I would like to thank him. This is just the beginning. I'm sure in another 2 weeks, we will have another interesting topic to continue to boost our knowledge, our capacity, and strengthen our knowledge management system in the department. So thank you, and I wish you a pleasant day. And there's a holiday tomorrow. Happy June 12th in advance. So thank you, Dr. Olugbenga Ijaodola, for a nice presentation. And we look forward to the next one in another 2 weeks. Good morning.
All right, so thank you very much, the DHPRS. Thanks for your leadership and for always encouraging us to do more. It's work in progress. We expect that we improve as we move forward. I'm not sure there's any question. Please do well to, there's a feedback form that has been shared to us. Please do well to populate, just fill it. It's strictly anonymous. Tell us what you have gained and how we can improve the process moving forward. So please, it's already on the chat box. Do well to fill this. We still have about 5 minutes to the end of the session. So your feedback is very important to us. Next topic will be announced, and the director has directed that it's now fortnightly. So in the next 2 weeks, we'll announce who the division that would take their turn. Thank you, Research and Knowledge Management, for anchoring today's session. I think we are good since there's no questions.
Sorry, Dr. Ego.
Yes, please.
Yeah, so we have 2 questions in the Q&A. Then Chidima
okay.
is also raising a hand.
Yes, please. Apologies. So, Dr. Anthony Adoge is thanking you, Dr. Olugbenga. He said, what percentage of research outcomes are proposed to inform policies in the next 2 years? And then Mr. Hamza is also say our research is often directed towards addressing gaps in areas that align with government policies, which may shift when a new administration takes place, of course, yes. So what happens to ongoing research or its findings when these priorities are changed? Dr. Olugbenga, are you able to quickly respond to those?
Okay, all right. Thank you very much. And thank you very much, Dr. Anthony. I don't know how you were able to quantify the percentage of research outcomes, but what I can say is that to inform policy in the next 4 years, what I can say is that if we are able to embrace the use of research in terms of identifying our priorities, I think we'll be able to have more clear understanding of the understanding of how to be able to align our policy directions and be able to get and improve its outcomes. Like I said, 4 years, that is 2030. And with the way the current administration is identifying those key areas that needs to be worked on in terms of meeting the universal health coverage, I think it's important for us to see how we ensure that we start asking those questions in all those key areas, looking at the current data, understanding exactly which part of the country is it that we are improving, we are doing more, and which part of the country is it that we are lagging behind, what are the root causes, and what do we need to do to improve on that. So for the second one, you can't do anything about the change of government. You can't do anything about government priorities, but that's why we have the institutional memory, so that we're able to sustain the necessary key institutions across all our various government agencies and parastatals. And this is expected to be able to sustain, even with change in priorities across board, is something that will give us a kind of a process for us to be able to align and ensure we are able to sustain this as much as possible. How do we evaluate whether policy based on research are achieving desired outcome? That's exactly why when we develop policy documents, you know, there is always the monitoring and evaluation part of whatever it is we are developing. We have our health sector strategic blueprint now, and then we have also developed the MIE component of that particular effort. So the MIE component is expected to provide direction and all the various activities for us to be able to see whether what we have put there as part of actions are being followed and in line with what we have set to do. Over.
All right, so thank you very much for those answers. So just to also put out there that most times, most pressing issues are how to ensure implementation of recommendations from those evidence-informed policies or research findings. So it's not a question, but let's ponder how we are able to ensure those recommendations are implemented appropriately. Thank you very much, Dr. Olugbenga, for your outstanding knowledge sharing today. We are grateful. And this is 10 a.m. On behalf of the director who has given his remarks already, we thank everyone for your patience and for joining the call. See you next episode. Thank you, and over from here.